I'm going to talk about another technique, that is fluorescence polarization immunoassay technique, FPIT, or fluorescence polarization immunoassay, FPIA. This technique involves two different procedures or two different identification molecules or procedures. For example, it uses a fluorescent probe as well as it will use plain polarization of the light as an indicator for investigation of the target molecule. It is a two-stage non-classical competitive assay used for the investigation of therapeutic drugs which are used for the clinical purpose, treatment of diseases, as well as it is used for the detection of illegal drugs, that is abusive drugs. Similarly, it is also used for detection of abnormal illegal hormones which are used for performance enhancement. And all these investigations can be carried out in the body fluids like serum, plasma and urine. Similar to the previous assays, that is EMIT and CIT, here also there is no need of multiple washing steps. The assay is carried out directly in the target sample. For the assay purpose, the drug molecule is conjugated with fluorescent molecule in this procedure. Whereas in the previous case, the drug molecule was conjugated with the enzyme. Here in this case, that is in FPIT, drug molecule is conjugated with fluorescent molecule. The fluorescent probe on conjugating with drug molecule will give a different intensity of fluorescence compared to the molecule without the conjugation of drug. So initially, after the formation of complex of drug with the fluorescent probe, the fluorescence is measured of the drug molecule fluorescent probe complex and it is recorded, which is the base fluorescence of the drug fluorescent probe complex. Then the antibody corresponding to the drug molecule which is to be detected in the sample is to be added. The antibody will recognize the drug molecules and form a complex with the drug molecule through the FAB site. If the FAB site of the antibody molecules are engaged by the suspicious drug, then fluorescent molecule complex drug molecule will not have any chance to bind to the antibody. Therefore, in the test solution, when you add the antibody, if the suspicious drug molecules are present, they will engage all the FAB sites of the antibody and the antibody will not be available to bind to drug molecule fluorescent complex. Therefore, the drug fluorescent molecule complex will be available freely and the fluorescent shown by that will be as in the previous case when you prepared the drug molecule fluorescent probe complex. The fluorescence of the sample will resemble the fluorescence of the original drug molecule fluorescent probe complex. Whereas if the drug molecules are not present in the sample, then the drug molecule fluorescent complex will engage the FAB sites of the antibody. Since the antibodies are going to bind to this drug fluorescent molecule complex, the fluorescence shown by such antibody complex with the drug fluorescent complex will be different, and it will be weaker fluorescence compared to the fluorescence shown by the original drug molecule fluorescent complex. Based on this, one can identify the presence of drug in the sample. At the same time, the second identification procedure is used using polarimeter, where plane polarization of the light is used as an indicator for identification of the complex formation. It is observed that the polarization shown by the light when the drug molecule fluorescent probe complex comes in its path will be of a different angle compared to the polarization of the light shown by the antibody bound to the drug molecule fluorescent complex. And the variation will be so huge that you can immediately make out that the polarization shown by the antibody complex with drug molecule fluorescent complex indicating the sample is negative for the drug that is being investigated. And that polarization will be of different index compared to the antibody bound to the plain drug molecule, because the drug molecule per se will be of smaller molecular weight compared to drug molecule complexed with fluorescent probe. Therefore, that antibody which is bound to the drug molecule under investigation, which is present in the sample, it will show a different type of polarization index. Based on this, one can conclude whether the sample is positive for the drug under investigation or negative for the drug under investigation. The abusive drugs under investigation, if it is in excess in the fluid, more of it will bind to the FAB site of the antibody, hence leaving the labeled drug molecule, that is molecule bound to the fluorescent probe, free, and that fluorescence will be brighter, as I mentioned earlier. If the abusive drug is not present in the fluid, all the FAB sites of the antibody molecule will be occupied by the fluorescent drug complex, giving rise to different intensity of fluorescence, which is less than the fluorescence shown by the drug fluorescent complex, and polarization of light will be at different angle. So that is how the investigation can be carried out for the samples using a dual technique, that is fluorescent polarization, that is fluorescence as well as polarization of the light. Therefore, it is called as FPIT.